So next off, we're going to be talking about why miscommunication may be happening in your hospital. To start off, us as healthcare workers need to use the technology that is available to us, meaning get rid of all paper charts and switch to some sort of electronic health record. For this presentation, we are going to use the system Epic just because that's what we're familiar with. However, there are multiple systems out there that you can use. So why is this important? Number one, all healthcare workers will be on the same system. This is going to make it easier for workers to be able to see each other's notes, procedures, labs, and other important patient data, decreasing the likeliness that something important will be missed. Number two, this is going to improve patient safety. Workers will be able to have a check system making sure that they are given the right patient, the right medication with the right dosage. If you go to a patient in 201 and her name is Miss Smith, but you also have a Miss Smith down in 205, when you scan one of them, it'll tell you if it's the right patient before you administer the med. If it's the wrong Miss Smith, it is going to give you an error, and that's just clarifying that you should not follow through with the administration of the drug. Number three, no more dealing with physician handwriting. When healthcare workers such as nurses, case managers, therapists, or any other workers are actually able to read the physician order, this reduces the risk of medical errors because there shouldn't be any confusion. There's been instances where I've been on the floor and I'm not able to read a physician order, so I have to go ask nurses around me or even charge nurses what the order is trying to say. Not only is this frustrating, but it's also taken away from your patient care and taking time away from you delivering the care that your patient needs. So in this video, it's just a hospital that has switched to the system Epic, and it talks about the benefits that they have seen since they did switch.
It's an epic undertaking, the first step toward paperless records. Everything under the Lee Memorial Health System umbrella is being streamlined into one database.
This is a next generation, more capable electronic record, and it also is one that will allow the very same electronic record to be used across different care delivery settings.
Gulf Coast Medical Center is the first of 4 hospitals to go live with electronic health records. Outpatient centers will be added in the coming months. By the time it's all said and done, between 8,000 and 10,000 computers will be tied into the same system, speaking the same language, following patients wherever they go.
An important test result from the last encounter, you may have had allergies presented from the encounter before that, and that summary is from multiple encounters. It's the physician see all relevant information.
As the Epic system goes system-wide, it will create more accurate health records.
They get a better snapshot of the patient
And keep patients from getting duplicate medical tests and filling out redundant forms. It will also manage and track prescriptions.
so we can do chart review where we can look up any previous visits that they've had.
ICU nurse Betty Grondike is a system super user. She's helping her peers get up to speed.
We're also able to chart real time so that the information that we're giving to the physicians is up to date, and clinical decisions are based on the information that we're inputting.
There are already evidences where that seamless record has made a difference.
Putting stock in computers rather than paper requires hefty support and backup. For Lee Memorial Health System, I'm Amy Osher.
So as you can see, it's not only beneficial to the healthcare workers, but it's beneficial for the patients as well. When you have your frequent flyers who come in multiple times a year, they're not having to fill out the same record every time. Once it's put into the system, it should be there, and they shouldn't have to edit it unless something has changed. Whereas when you're using the paper charts, they have to use those documents every time the patient gets admitted. So on this slide, what I've done is I've taken an order from a BSA physician. While some people may be able to read it easy, there's new graduates out there who are trying to get used to the physician handwriting, and it may take them a while to decipher what it's trying to say. On the left-hand side, I have 3 arrows, red, blue, green, and same on the right-hand side. It's the same order. On the left, like you can see NPO, for example. On the right-hand side, it's also NPO diet. It's plain as day. You shouldn't have to second guess what the doctor is ordering. So the purpose of this slide is just to show that some physicians may have horrible handwriting, so it's just easier to use the online system and there's no confusion. Once the physician orders a new order, all the nurses have to do is go in and acknowledge it. The order doesn't go away. You can go back later on during the day and double check your orders again just to make sure you haven't missed anything. Whereas when you have a paper chart, 3 people may be needing that chart at the same time. So you may have to wait, 30 minutes to an hour to go back and double check that order until the chart is available again. So with the electronic record, all 3 people are able to get on the system at once and check their orders and not having to wait to delay patient care again. So just a couple questions to end. Number 1, true or false, using technology increases the risk for medical errors. This is false. When healthcare workers use this system, they should be using the double check system, scanning your patient, scanning the drug, making sure you get the green check mark. If you don't, then obviously you shouldn't proceed with the medicine that you were trying to give. Number 2, which of the following does not improve when switching to an online charting system? That's D. All of these should improve. Communication between each healthcare worker should be better. Your patient care should be better because you're spending more time with your patient, not trying to decipher what each order says. And your medical errors should improve because you shouldn't be giving wrong patients wrong medications. Number 3, true or false, if hospitals get rid of paper charts and go to an online system, all healthcare workers will have easier access to patient charts and have more accurate information. This is true. Just like I said in the last slide, healthcare workers can all look at the same chart from their different computers. So the nurse, the therapist, and the case manager can all look at the same patient chart at the same time and get in there to do their job. They don't have to wait for the chart to double check. So now that we've discussed how technology can improve communication, Gabrielle is going to discuss how everyone will personally contribute to correcting these concerns and contribute to making BSA a great place to work.